I completed my bachelor's degree in nursing here. Then I stayed for my master's degree and I became a family nurse practitioner. I applied to UCSF and they had a 3-year fast-track program through the Gordon and Betty Moore Foundation. So I went and I completed a PhD in 3 years. So ever since 2007, I've been here full-time on the tenure track. And I'm in the School of Nursing, or the College of Applied Sciences and Arts, in the Valley Foundation School of Nursing. So I primarily teach maternal child health. I'm a graduate from here. It feels like I'm at home. It just feels very natural. So, and the faculty are fabulous. San Jose State's been very generous. I've received several small incentive grants to do a lot of my research. And so I'm hoping to build on that and get some federal funding. My main area of research is postpartum depression. I look at postpartum depression in women and families. It's important. Mothers are usually the primary caregivers of the infants, and depressed mothers are less likely to take their babies for immunizations, for maybe use car seats properly. And again, the biggest risk is readiness for school, that they're not ready to go to school. And I thought to myself, I've never heard of this before, this postpartum depression. What is it? And so, I started looking at the literature and found that it happens in up to 20% of women everywhere. And the most interesting fact was it hadn't been examined in Asian American women. And so that's kind of where I started to examine that phenomenon. So my first study was while I was a master's student, and I was interested in Asian Indian women like myself, because I'd never heard of it. Usually Asian Americans are lumped together in studies. We're not separated into Indian, Chinese, Vietnamese. And there are differences among the cultures. There are different childbirth traditions. There are different postpartum traditions. And so part of my work has been looking at the differences. So I collaborated with another faculty here at San Jose State, and we did a series of qualitative interviews with postpartum Asian Indian, Chinese, and Vietnamese mothers. And we just wanted to ask them their perspectives of depression, what do they think of depression. And the study I did was the first one that was published in America on Asian Indian women. Part of it is in Asian cultures, depressive illness or mental illness is highly stigmatized. In general, Asian Americans are more likely to have health insurance and access to mental health care, but they're the least likely to access mental health care. The stigma is going to be a big issue. So what can we do? What are the alternative treatments that we can offer them? There are other risk factors for postpartum depression, things such as infant temperament, so how much an infant cries. Socioeconomic status is a big one, and marital satisfaction. And the big thing is sleep fragmentation. New mothers don't sleep. They typically don't sleep because their babies don't sleep. And so that sleep fragmentation really, it puts you at risk for postpartum depression. And whether it's postpartum depression because of chemical disorders in the brain or whether it's from sleep fragmentation, it's really important to find out. Because if it's sleep, we can treat that. We can tell parents to get a good night's sleep, maybe hire someone or have the dads give the night feeding. The most important thing to tell women is 80% of you are going to have the blues and this feeling of just not feeling right and emotional, being very emotional after having a baby. But if those symptoms linger more than 2 weeks, you really need to talk to someone. And that's the part that we're not telling them. Because women are afraid, they don't want their children to be taken away from them. They fear that. We're still working on ways to better capture these women earlier, to diagnose and identify these women earlier. But what's coming out now in the research is untreated postpartum depression has severe risks for the whole family. There's problems with maternal-child bonding. There's cognitive development issues, delayed readiness for school. So it's everyone's problem. We can't keep pushing it back and forth.